So this is the x-ray of older patient who fell last night. She has a lot of pain on her left hip, and as you can see, she's already got some major hardware from a previous fracture. She has pain of movement. The other thing to notice here you can see a pubic Raymond fracture that's healed. That's an old one. She's got obviously some surgical stuff, some nodules here, a lot of gas, a lot of soft tissue, kind of floppy over here. But the main thing here in the finding is this here, is the lesser trochanteric hip fracture right here. Now lesser trochanteric, the management is slightly different. It might not necessarily be surgical, there might not be anything to do. So I've consulted surgery orthopedics to see what they say about this. So on this patient with the lesser trochanteric fracture, after consultation with the orthopedic physician, it ends up being that they have a lesser trochanteric fracture. They're very likely to have a greater trochanteric or even an intertrochanteric fracture. So although it seemed intact on that x-ray, he decided to admit the patient to probably get a CT scan or other kind of imaging, probably a surgery to review that fracture and maybe even repair it. So the lesson to learn with this is, even if it's a lesser trochanteric fracture that you have higher level of suspicions for underlying fracture across the trochanters, and the possibility of surgical intervention anyway, and not just discharge patients home with that, because like pubic Raymond fracture, iliac wing fractures, those you discharge home, you don't treat those emergently. So that's the lesson to learn with this little video clip about that x-ray and the injury, and I hope you learned something. I sure did. Bye bye.